Hello and welcome back to GP Video Podcast by Nadia. Today we are going to talk about irritable bowel syndrome. I'm sure you guys have all heard about this term. What is irritable bowel syndrome? So we will go about it point by point, and I might have to make, as I always make, at least 3 to 4 video podcasts on a single topic. So we will do that the same with this because irritable bowel syndrome is a very common condition. So what is irritable bowel syndrome? Irritable bowel syndrome, or IBS, is the most commonly diagnosed gastrointestinal disorder affecting at least 10% of the global population. So it is the most common gastrointestinal disorder affecting at least 10% of the global population. What is IBS? What is it characterized by? It is characterized by chronic or recurrent abdominal pain associated with a change in bowel habits. So two things basically, abdominal pain and change in bowel habits, which means either constipation or diarrhea or both of them, alternating with each other. Most patients can be classified according to their predominant stool pattern. So as we said, that what is their stool pattern? Into IBS with diarrhea, IBS with constipation, or mixed stool IBS, in which diarrhea alternates with constipation. So basically, what is irritable bowel syndrome? It is characterized by abdominal pain and a change in bowel habits, which is diarrhea alternating with constipation. Other symptoms may include mucus in stools, bloating, gassiness, and feelings of severe illness. IBS symptoms can be triggered. Now, what is the cause? What could be the trigger, or what could be the risk factors? So IBS symptoms can be triggered by certain foods, stress, and often get worse around menstrual periods in women. So now what we have learned so far, we have learned that IBS, which is irritable bowel syndrome, is the most common gastrointestinal disorder affecting around 10% of the population, global population. What are the symptoms of, or what is it characterized by? It is characterized by abdominal pain and change in bowel habits. Then what are the triggers? What are the risk factors? It is triggered by certain foods, stress, and often gets worse around menstrual periods in women. What are the other symptoms apart from abdominal pain and change in stool pattern? The other symptoms are mucus in stools, bloating, gassiness, and feeling of severe illness. People with IBS are more likely to have other disorders such as fibromyalgia, major depression, or chronic fatigue syndrome. IBS occurs more frequently in young adults and affects more women than men. Now, IBS is a functional disorder, meaning the bowel does not function properly, but there is no observable structural damage. A big controversy regarding diagnosis of IBS is some of the clinicians think that IBS is a diagnosis of exclusion, while the others think that IBS should be proactively diagnosed using a criteria called Rome criteria. So I usually am one of those clinicians who really think that IBS should be a diagnosis of exclusion. My idea is that when a person presents with abdominal pain and diarrhea alternating with constipation, our duty as a clinician is that we should be excluding all the organic causes. Like, for example, if somebody is coming to me with alternating diarrhea with constipation, the first thing which comes to my mind would be to exclude colon cancer. Or I would like to also exclude conditions like diverticulitis, or I would like to exclude conditions like, let's say, irritable bowel disease. So irritable bowel disease is actually different from irritable bowel syndrome, because irritable bowel disease has got the problems like the structure in the wall, okay, in the lining of the wall, in the muscle of the wall. So we need to, because those IBS does not have a definitive treatment. Okay, it's a functional disorder. But conditions like colon cancer or irritable bowel disease or diverticulitis or polyps, all these conditions can be treated. So But nowadays it is very much encouraged that clinicians do not take it as diagnosis of exclusion and try and actively diagnose it using the criteria. What are those criteria? We'll talk about them tomorrow.